Houstonians, you're more likely to have serious health effects from the flu than from Ebola. And when someone is asymptomatic, they're not transmitting Ebola, so they have to present with symptoms. What would the symptoms be, Dr. Persse?
So tragically, the symptoms are very much like the early flu. It's going to be an onset of fever, body aches, just an overall lousy feeling. We hear on the news, we hear about the vomiting and diarrhea, and that does come along with it. Generally, vomiting and diarrhea are generally not flu symptoms, but during flu season there are other viruses that come around that will cause that, and it's not surprising that the public confuses them. They say, I've got the stomach flu, there really is no stomach flu. The late signs and symptoms of Ebola, the rashes and the bleeding, those are very, very late in the course, and people are generally quite ill. So the challenge, as the mayor points out, is that early on, the symptoms for both Ebola, the flu, and the many other viruses that circulate this time of year are all just about the same.
And so the message is that if you are ill and you have no known risk factors, you haven't been traveling in Ebola-prone areas of Africa, you probably have the flu, but the best thing for you, whatever your symptoms are, to stay home.
Right, but well, you want to stay home, reach out to by phone to your healthcare provider. The other thing, Mayor, is just the plug we always make is if you don't want to find yourself in that situation, get the flu vaccine. They're out, they're available, all kinds of different ways you can get it, and that would keep you, hopefully keep you from developing the symptoms if you get exposed to the flu.
Also, Houston is an international city. We have a huge international airport. The federal government has not designated us in the first tier of airports where there are actually, I guess, CDC officials on the ground screening passengers. But there are protocols in place in our airport system.
So what generally happens, and we've done this a number of times already, the flight crew will recognize that ill passenger. They radio ahead through their airline to the CDC. And we do have a quarantine station at Intercontinental. They cover both Hobby and Intercontinental. And as that flight comes in, they coordinate with the flight crew and the Houston Fire Department, our paramedics and EMTs that are at the airport, and will meet the aircraft at the gate. They will board the aircraft. The CDC folks, their role is to basically get the history from the patient to find out what we think that their illness may be. And if they meet the criteria, then the role of firefighters is to make sure that everybody has their PPE on and transport the patient to the hospital. The CDC also then will get the contact information of everyone who is seated near that passenger, and so we can track them in the event, because we don't have a diagnosis, we only a suspect case. If it turns out that it was Ebola, we then need to do the contact tracking of the people who are seated near the passenger. And as I said, we've already done this a couple of times. So far, every time it's turned out to be nothing, but we've done it just as a drill. We've done it in real life a couple of times in the last couple of weeks.
For passengers experiencing symptoms who come in by plane from areas of Africa that have high incidence of Ebola right now, the symptoms of Ebola just mimic the symptoms of malaria, just as they mimic the early symptoms of the flu.
That's right. That's actually right. In fact, we've had a lot of false calls, if you will, and that when we actually talked to the patient, we found out that they didn't meet the case definition. They hadn't been in there. They were from a different country in Africa, for example. But for the ones that didn't meet the case definition, so far, all of them that I'm aware of, well, certainly all of those that have been here in Houston, they've turned out to have malaria. So malaria is quite endemic, and a lot of folks in that area deal with malaria, so it's not uncommon. We see people with malaria. We've been seeing people with malaria here in the Houston area for this exact same pattern. Ebola hasn't changed that. That's been going on for years.
And well, Houston is a very welcoming city and is a city used to dealing with international visitors. I know there are some Houstonians who have made statements like, well, we should just prohibit folks from Africa coming into Houston. We should block flights from certain areas of Africa. Why would that be ineffective?
So from a public health medical standpoint, well, first of all, the flight that we get from Africa right now comes from Lagos, Nigeria. which is about to fall off the list of our worrisome countries. So it would have no benefit. The other thing is because we are in such a world where people move so much, and you can get somebody who could go from a country that we're worried about to another country, and then so, you know, if you were to do it, you basically have to shut down. If you wanted to, in my opinion, if you want to shut it down, you need to shut down everything. Because shutting it down just from Africa doesn't, that's not going to catch it. You're going to create a lot of economic and emotional turmoil, and you still got big holes in that net.
Thank you. We're a global society, and that there are benefits, but there are concerns about it. We've rightly captured them. There are a number of council members with questions. Councilmember Lassiter.